I just want to make 3 points, and then we'll jump in. And the main point here is really to have a discussion and get your questions. One is that the healthcare system is profoundly unbalanced. We spend an awful lot of money taking care of the consequences of after people get sick, and not nearly enough to prevent illness. And if we were able to prevent illness, if we were able to keep people healthy, they would be more productive, our economy would be healthier, and our overall healthcare costs would go down. Second thing is, it is possible to turn the ship in healthcare. There are examples of where that's been done. And strategic investments can liberate the money, and some people have called it trapped money, trapped capital, money that is in the expenses for those strokes and heart attacks and asthma attacks, to invest up front in community health and pull that money out of the acute care system and be able to reinvest in keeping communities healthier. And that's the underlying philosophy of the Health Enterprise Zone. It is a type of investment in community health that helps provide some more balance and more health to the healthcare system. The third principle is that has to be a strategic investment. It has to be strategic with the partners that you have. There are a number of healthcare institutions, including hospitals and insurers, that now have incentives. It works for them if people stay healthier, so they're strategic partners. But the strategy cannot be put together in Baltimore. Even for Baltimore, it can't be put together out of my office. It has to be put together by people who understand the community, know what the needs are, and see the opportunities. And so rather than say, and let me tell you, the Lieutenant Governor has been a phenomenal leader of this. This would not have happened without him. And it is very easy for someone in his position to say, okay, I got an idea. Let's hire someone in every area. Everyone, they'll go around and they'll do something, and it'll all be driven from us. It'll be a very top-down approach. But he understood, and in his leadership, he's been made very clear that we will not succeed unless these plans really have the support of communities. That they understand their areas, they understand the possibilities, they can align the resources. We're going to make resources available to them. And that's really the premise behind Health Enterprises. We want to make resources available. And here's the excellent point here from my perspective, is that there is value just in people coming together and thinking these issues through and realizing those partnerships and coming up with those plans. And we're going to be able to fund some of them through the state. I think we're going to have some opportunities, and I hope to get some federal funding to ride on top of that and fund additional ones. But once you have that plan, you're halfway there. Once you have a plan, you have the connections, you have the, wait a minute, we do have a financial incentive. If you can keep patients out of the hospital with asthma, then we actually save money under the way we're paid now, and we're willing to pay you to do that. So you can start to pull together systems across the state, and we're going to be doing a lot around the state to catalyze those types of connections. And certainly you know about this in Montgomery County, because a lot of it has been going on here already. So with that as a background, those 3 points. The healthcare system is profoundly unbalanced. It can be put in better balance, but the recipe for that really has to be brewed up locally. That's really the concept behind these zones. And we really want to see strategic investments guided and overseen by localities and local coalitions, making a real difference across Maryland. So